Okay, here we go. A healthcare provider continuously dismisses the nursing care suggestions made by staff nurses. As a result, dealing with the healthcare provider, what action should the nurse manager implement? Plan an interdisciplinary staff meeting to develop strategies to enhance client care. A 2-year-old girl is brought to the clinic for a routine assessment, and all findings are within the normal limits. However, the mom expresses concerns over her daughter's protruding abdomen and tells the nurse that she is worried that her child is becoming overweight. How should the nurse respond to the mother's comment? Explain that a protruding abdomen is typical for toddlers. A female client reports she has not had a bowel movement for 3 days, but now is defecating frequent small amounts of liquid stool. Which action should the nurse implement? Digitally check the client for a fecal impaction. A client admitted with an acute coronary syndrome receives eptifibatide, a glucoprotein inhibitor, which important finding places the client at greatest risk. Unresponsive to painful stimuli. A toddler presents to the clinic with a barking cough, stridor, refractions with respirations. The child's skin is pink with capillary refill of 2 seconds. Which intervention should the nurse implement? Administer nebulized epinephrine. The nurse caring for a client with dysphagia is attempting to insert an NG tube, but the client will not swallow and is not gagging. What action should the nurse implement to facilitate the NG tube passage into the esophagus? Flex the client's head with the chin to the chest and insert. The nurse plans to use an electric digital scale to weigh client who is able to stand. Which intervention should the nurse implement to ensure that measurement of the client's weight is accurate? Ensure that the scale is calibrated before a weight is obtained. The nurse observes the newly hired unlicensed assistive personnel performing a finger sip to obtain the client's blood glucose. Prior to sticking the client's finger, the UAP explains the procedure and tells the client that it is painless. What action should the nurse take? Allow the UAP to complete the procedure, then discuss the painless comment privately with the UAP. An African American man coming to the hypertension screening booth at a community fair. The nurse finds that his blood pressure is 170/94. The